welcome to the Balance to Excellence podcast with Dr. Judy Wright, Life Balance and Wellness Strategist. And today I am talking to Dr. Giovannie Jean-Baptiste, MD, MBA. She is the Senior Vice President of Employee Health Services at Robert Wood Johnson Health.
Barnabas Health.
Barnabas Health, thank you, in New Jersey. And by trade, Dr. Jean-Baptiste is an internist and a geriatrician. She has worked in a number of settings where she did direct patient care. She's also a speaker. She is a published author. She was the first African-American and African-American woman to be the president of the Richmond County Medical Society in New York City. Welcome, Dr. Jean-Baptiste.
Thank you. Thank you so much.
So I'm just going to let you all know right off the bat that I know Dr. Jean-Baptiste. I've known her for years. She is not only a colleague, I consider her one of my greatest friends. And so some of that was not hard to rattle off at all, right? For me, no, but she's very dynamic, and I'm just honored to have you on with me today.
Thank you. Thank you so much. Honored to be here with you.
Thank you. All right. So the first thing that I would like to know is, could you share a bit about how you got here, your path in healthcare? Could you share a bit about that?
Wow. Where should I start? How far back should I go?
Wherever you feel comfortable. And let us know what inspired you to even choose this career in the first place.
Okay, now that's an easy one. So that's easy. That one I have an answer to. So at the age of 9, my mom was going to have a medical procedure. Obviously, I was 9. I didn't understand anything. Had no idea what my parents were talking about. And what my parents did was send us on a summer vacation to the Poconos with my aunt and uncle and cousins while my mom had her procedure. So you can imagine what goes on in the mind of a 9-year-old, right? I know that something's happening. I know that my mom is seeing a doctor, and I'm thinking in my mind, well, what can I do to fix that, right? So when she came home, obviously, and she was better, I was convinced at that time that I was going to be a physician because I wanted to be able to fix. I was going to be able to care for my mom, fix whatever happened, and fix others. And that's my earliest memory of wanting to be a physician. Prior to that, I wanted to be an astronaut. I mean, I said that all the time. So
that's a big jump. Okay.
A little bit of a shifting gear. But yes, it was always an astronaut until that particular thing happened with mom at the age of 9. And here we are many years later.
Yeah. I mean, that's wonderful. A lot of us, I mean, some people, they figure it out late, but there's a lot of us who pretty early on in single digit ages, for me, it was 8. And it's because I'm a nerd that liked going to see doctors. But, a lot of us really had something that honed in pretty early on that made us say, man, we want to do that. That's like excellent what they did. They're like transforming lives, even though we probably didn't say at 8 and 9, transforming lives, but that's how we saw it. And we wanted to do that. So wonderful. So I know because you've had an extensive career, seriously, but if you could just explain, like, how was your path into healthcare?
Okay, now that's another long story. How much time do we have? So going into medical school, I was 100% convinced that I was going to become a pediatrician. I was going to be a neonatologist, and there was nothing you can do to change my mind about that. And I remember our 3rd year of medical school, I did my very first pediatric, and prior to that, I volunteered at hospitals as a teenager. I was a candy striper.
Same.
I volunteered in the nursery. It was great.
Yeah. And
I specifically remember as a 3rd year medical student, we were doing our pediatric rotation, and there was, I'm going to say this child was about 5 or 6 at the time and was getting vaccinated. and this child was very afraid of needles and a little bit combative. The needle stuck. I wasn't giving the injection. The pediatrician did it. But the child's foot landed in my stomach. So I said, oh, okay. I don't want to do pediatrics anymore. These kids fight back. So that instantly, honestly, even though I really enjoyed my peds rotation, I joke about that moment as being pivotal. And it was only because that's something that I remember. But honestly, the most pivotal moment was when I did have the opportunity to actually rotate through the neonatology wing. I think I was probably there for a week or two. And when I really had a chance to look at the infants or the preemies, the infants, and see what it takes, to keep them alive and get them to a point where they're viable. I saw daily pain in parents' faces, right? As you're looking at a newborn, having a baby is supposed to be an amazing experience. And then I would just look at how painful that was for them. And I thought to myself, emotionally, this would probably take too much from me, so I couldn't do it. The second thing was all the math that you have to do in neonatology, as you convert things to their weight. And I thought, I need a special calculator for that, but I can't do that. But honestly, it was the emotion that was tied to it, right? It was the emotion that was tied to the parents. And I thought, I don't think I can do that. I think it would take too much of me. So neonatology was not it. So clearly the end of the other spectrum is geriatrics, right? So that seemed natural. So I ended up in my internal medicine rotation. And honestly, what I enjoyed was the relationship, right? As an internist, you are the primary care doctor. And what I enjoyed was the longevity of the relationship, right? The interaction with the patient, the conversations you can have, right? That I couldn't necessarily have in peds or in neonatology for that matter. So hence internal medicine. During my internal medicine residency, I wasn't even thinking geriatrics, honestly. I was just thinking internal medicine. I did do some geriatric rotations and thought, as you get older, there are gifts that you have, the gift of wisdom. And I enjoyed the interaction of talking to my elderly patients. And again, building another type of relationship, right? Where I'm not telling them so much what to do. I'm learning from them. And that's when I thought, geriatrics, I like this. I enjoy the interaction that I had. I love the conversation that I had. So in doing so, graduated, did my fellowship in geriatrics, and focused a little bit on hospice. I did home visits. And during my home visits, I was called and asked if I wanted to do hospice home visits. And I thought it, only a natural thing. So went into hospice. Which was again emotionally taxing, right? Because you'll see a patient, and it may be the one time you see them. You may see them again. You may not.
You may not. I told you
But I
about that because I was like, okay, talk about emotional.
It was. I mean, there again, very simply. I mean, there were people that I saw once, right? Because they were that close to the end of life. And then there were people that I saw for 6 months until I had to recertify them. So hospice was very interesting. Shortly after that, I mean, I was also the medical director, associate medical director of a nursing home, and ended up in correctional medicine, which will probably take another hour to explain how I ended up there. Again, very rewarding. Everyone needs a physician. Everyone needs good care.
That's right.
So it was something that I actually enjoyed. And honestly, the only reason why I left correctional medicine is because the facility that I was working in actually was shut down because there weren't, and this was in the state of New York. And there was a sweep at the time where they were looking at the number of inmates in facilities, and those that weren't full were closed, and they consolidated. That's the reason why that facility closed. So then we now get to the good part. So after correctional medicine, I ended up in the insurance industry, which was very different, right? So here we are now with a career in medicine where I'm no longer building that relationship with patients because I'm not seeing patients anymore. I switched to working from home, which was in itself something spectacular, right? To be able to do your job as a physician from home. It took a lot of getting used to, right? It took a lot of getting used to because I wasn't seeing patients anymore. And I did that for 12 years.
Yeah. Yeah. And so, pretty interesting. I'm going to I'm going to get back to questioning you about the transition out of direct patient care into that industry. But did you, along the way, because it's a long way, no one going into medicine started at the point that they got into medical school, right? It started years before that, right? Whether it be you went back to college, because some people, they had other careers and they decided to go to school. But for some people, it started back when you were a candy striper volunteering in the hospital, right? So, any challenges along the way as you were going on your journey and your path? Did you, in your positions, any challenges that you noted along the way?
As a physician or prior to entering medical school?
Whichever one you feel most comfortable with.
I think that there were challenges along the way, along the entire path. When I was in college studying for those MCAT, which the entry exam obviously into medical school, studying for the MCAT, I felt as if I didn't know enough. I felt like I wasn't good enough. I would take standardized exams and they didn't represent what I knew. And I remember taking the MCAT the first time, and I took it a second time, but I remember taking it the first time and not doing well and thinking to myself, well, maybe this isn't what I'm supposed to be doing. And I specifically remember that because I was at Florida International University, and I thought to myself, oh, maybe I can become an anthropologist instead. I actually took an anthropology class.
No
Yes,
judgment.
anthropology.
I was a sociology major. No judgment. I just didn't see
Right,
that one.
right. I mean, I thought, I enjoyed anthropology. I didn't do that well on the MCATs. I'm like, oh, maybe anthropology would be what you can do. So I think the beginning for me, the beginning of my quest was my own insecurity and challenges with taking standardized exams, which did rear its ugly head when I actually got into medical school. I did have difficulty with standardized exams. I did end up, taking extra tutoring and extra time. Honestly, took extra time to get through medical school. That is a thing that sticks out as the biggest challenge for me was my test taking skills. Again, I didn't think it represented the knowledge that I had or who I was.
Right.
To be seated for a couple of hours and have to regurgitate all of this information. I mean, it was in there, right? I clearly knew it. But I would get mixed up when I took standardized exams or exams, period. I think that I would work myself
up. It was not
up.
a couple of hours. It was not, you were not sitting for a couple. This is a test of wills and stamina, right?
Yes.
Yes. Not a couple of hours.
Yes. Yes. Yeah. I mean, if you take your board exams, that's all day, right? That's an 8-hour day. That's a work day.
Yep.
Of taking exams. So, that's something I definitely needed to overcome. And interestingly enough, if we move forward to where I am, as you mentioned, I did get an MBA in healthcare recently, and again had to take proctored exams and had to get over that fear, right? Had to really convince myself that I know this information, and it doesn't matter how they ask me, I'm going to get the answer right. So that was 2 years of a lot of convincing of myself, but I did it.
I mean, that's wonderful because what I'm hearing is a change in your mindset about what you were capable to do. Because again, let's go back to what we said. You are an internist, a geriatrician, you're a published author, you're a speaker, you have worked in a number of places. You have been the lead for a very long time. You are now senior vice president of employee health services. And all of that and the mind it can really tell you, woo. So that change in mindset and having that success mindset, kudos to you. That because that's very important. That we could psych ourselves out a lot.
Absolutely.
And so that's very important. Kudos to you. So let's talk about the transition. Because it was a transition, you
Mhm.
know, you were a primary care physician.
Yes.
Basically, that's a mindset of I'm here to take care of the community and this community here, and I'm going to help them. And you did everything from the office to being in homes all at the same time to being at the hospital,
Mhm.
rounding on patients. So in all those settings, and that was just like one, all the same patient base. Um, and so how you alluded to the fact that that was definitely a change. How did you deal with the change in mindset of I'm going to be this community doctor forever to I'm not taking care of patients now and what that feels like?
I was tired.
Yeah.
Um,
In a word.
I was tired. It's exhausting, So just to give a little bit of a flair of what a typical day was like, I would be up in the morning and I would round at the hospital. Let's say it was a weekend and I was on call. I would
Tell them what
aim
time
to
you get
be
there,
I
because
would aim to be at the hospital at 5:30 in the morning.
that's very important.
Yes, so 5:30 is a great time for anyone who's listening. 5:30 is an awesome time to round because all the charts are neatly at the desk at the time. Again, we're talking about paper charts, but all the charts were neatly at the desk because it was the night shift, right? And it was before the day shift came on and the nurses were signing out to each other. So 5:30 was an awesome time. So I would do 2 hospitals. So round 5:30, finish up all of my patients at 1, move over to the next. And then when I was done with the second, then I would get back in my car. If I had Saturday hours at the office, I would actually get all of this done before 9. And if I wasn't in the office, then it was a day for home visits. So then I would be out all of Saturday doing my home visits. And you spoke about this before. You and I have known each other as friends and colleagues for many, many years. And, oftentimes, you and I were on the phone together at 10 o'clock at night, right? Because we're still in our offices writing notes. Again, prior to electronic medical records,
Yes.
we're still sitting in the offices writing our notes. Our last patients may have been at 8:30 and it's 10 o'clock and we're still, wrapping up, writing notes, doing callbacks. And it's rewarding, right? I don't want to discourage anyone from doing, from that patient care in medicine, but I have to say it was exhausting. So the transition to a non-patient seeing career was refreshing. Um, the stress was not the same. At 5 o'clock, everyone was gone. Everyone logged off of the computer, and I often I would remember thinking to myself, well, what do I do now? It's 5 o'clock. What am I supposed to do? Wait, am I free? Am I free to spend time with my family? Am I free to make dinner? Am I free to take a walk? That was also a period of time where I really started looking at, this is a big topic for you, I know, and it's something that I'm still learning, but that taking care of yourself, right? That self-care. I remember walking, right? I remember walking more. I remember being outdoors more. I remember getting on the treadmill more because I actually had time. And at first, honestly, it almost feels like you're doing something wrong, right? Like I should be doing something related to work, but I'm not. And I don't even want to talk about how the weekends were, right? You wake up on a Saturday and you're like, wait, I'm not on call. No, I don't even have a beeper. Again, back in the beeper days. Um, I don't have a beeper. It's Saturday. I could go get my hair done.
That
I could
had
go
to be
outside and eat
strange,
ice
not
cream.
having. I know they like beeper. Not having a beeper, that had to be like super strange, because
It
when you know that
was.
you're on call and you have the beeper, like
Hmm.
there's a certain set to your body where you're like, at any time that beeper can go off,
Of course.
right? Yeah,
Yeah, so it was strange not having that with me at all times and almost being forced to be reintroduced into the world, right? Because now it's like, again, what do I do? What so much of my time was work. And now it's like, I have free time. So it forced me to figure out what I liked, right? What was I interested in? What did Giovanni want to do? Because I had time, which was amazing, truly amazing.
so I heard such wonderful things: the going for walks, the exercising, the uh sleeping in a little bit late, which that's not really late for us. Sleeping in a little bit late, but even just getting up in a relaxed way, right? How did Giovanni Jean-Baptiste, prior to that transition, how did Giovanni Jean-Baptiste find balance prior to that?
She didn't. She didn't have any balance prior to that. Prior to that period of time, my life was work, right? The 10 p.m. nights were almost routine. Um, I've told this story, in other forums. I remember that I had purchased a new home and had my kitchen painted. And I specifically remember that it was this yellow color, but it was like not quite like banana yellow, but it was a yellow and not bright, bright like sunshine yellow. And I remember I was finally off one weekend, and I was home, and it was 3 weeks after the kitchen was painted. And I looked around and I thought, oh, wow, this is a nice color. When did they paint? Oh, wow, they painted 3 weeks ago. But it was the first time in 3 weeks that I was actually home during the daytime while the sun was still up and was able to appreciate that color. Right. So that said, there was no balance, right? Because it was really all about work.
Yeah.
Um, it was really the beeper, the long hours. I did not balance well at all.
Wow. Wow. That's that story about not being able to notice. You know what that sounds like to me? When because we're in a part of the country that definitely was on lockdown for quite a bit during the pandemic.
Hmm.
And there was a big push by people to redo their apartments, redo their houses. Why? Because suddenly we had time, and now we're
Yes.
looking around like, oh no, that has to get fixed. Oh no, like, like suddenly, and I'm not talking about just being frivolous spending money. I mean, really, things that were glaringly obvious, but we were all so busy, we didn't notice it. We did not notice it. But now that we were in the house, not just in the house, but work for some people, work went down, you know, at half staff. For some people, work went away for a bit. And now you had time, and you're like, wait a minute, this is how it's been the whole time. Well,
Yes.
when you're running from place to place and trying to get things done, and then starting it all over again the next day, yeah. That's how it looks. So that
Well,
story about your kitchen,
yeah.
that's what that
Well, it's the proverbial stopping and smelling the roses. Well, it was
yeah.
stop and look at the paint colors in your home. You know, I was
That
finding
you
home.
picked.
Yes, that I chose. Yeah,
The ones that you chose. Okay, so now I want to transition to the fact that you have been and please correct me, you were like an executive director in your prior position,
correct. Executive medical director. Yes,
executive medical director, and now in your current position at RWJ Barnabas Health, you are the senior vice president of employee health, and you
correct.
oversee the medical directors there that are in direct patient care. So, medical
Hmm.
directors, I'm going to say nurse practitioners,
Correct.
any PAs that are involved, nurses, all of those. Correct?
Yes,
That's a lot.
it is.
That's a whole lot. So, what are the kind of challenges you encounter with working, with having all of those people report to you? Because with people comes personalities, but also the challenges of them working in that environment. What are the significant challenges and pain points that your team deals with and that you deal with as you try to lead your team?
So I think, something happened recently at one of our facilities, which it really highlighted safety. We had a patient come in to our one of our offices, and that patient actually had a firearm. A lot of our facilities are outside of the hospital. Some of them are in strip malls because, in addition to, so employee health is not just employee health for those who don't know. Employee health or occupational medicine is not just for hospital and employees. There are, large companies out there who use you or use us at RWJ Barnabas
Oh, okay.
as their providers of occupational
Got
medicine
it. Okay.
or employee health. So we do have external clients. So one of the things that sticks in my mind as you talked about this was the fact that some of our clinics are externally facing is safety of your employees, right?
Yeah.
So we did have a patient come in who was armed. The person was licensed to carry.
Mm-hmm.
Not a police officer. I'll just put it that way,
Mm-hmm.
but was licensed. And that brought up a safety issue, right? How do you keep? And that's something honestly that I would not have necessarily thought of. That wouldn't have been on the forefront of my mind. But it did end up being an issue. Is the safety of your employees?
Yeah.
So that's been a challenge for us. And when I say this, you're going to understand why some offices have a buzzer, right? Where you ring the bell, they check to see who you are, and you're buzzed in. If you're not in a building that has an elevator or a security officer, etc. If you're in a strip mall, there's a door. Do you need to be buzzed in? So these are some of the things that came up. So that was one really interesting challenge, which was actually very recent. So something on the forefront of my mind. The other big challenge, honestly, with having a staff, as you described, from all levels, right? From certified medical assistants to LPNs to nurse practitioners to medical directors, is putting together that whole host, all those personalities, right?
Yeah.
And I think one of the challenges for me as a manager is it's not the medicine, right? It's not the medicine that goes on. I mean, because that we look up, there's protocols for everything. It's the personalities, and I think to me as a manager, that's been the biggest challenge. It's understanding or attempting to understand the different personalities,
Yeah.
how they would work together or don't, and when they don't, what do you do, right? This is people's livelihood. What do you do with coworkers who don't get along? How do you how do you approach that? How do you have them work through that? Or do you? So I think for me
Good
as a
question.
manager, that's been the biggest challenge.
Yeah. Um, that's a good question. Do you? And it's different when you're, have to deal with a lot of children, but we're talking about grown adults,
Adults.
licensed, certified. You have to, make sure that they are paid that level of respect as you try to manage your team. Um,
Yes.
and I know from experience that that could get a little hairy. Um, in terms of wellness, we have you're literally managing people who are trying to provide others with wellness care, with health care. So, in terms of wellness, as it pertains to, say, those that you manage, the very employees who are working there, the medical directors, the nurse practitioners, all of them, you know, is is there any, I'm trying to figure out, like, how do you all go about dealing with that, or do you deal with that, and has that come up as a pain point at all for you know your employees? Yeah.
100%. So I have to tell you that during all of our town halls or any staff meetings that we have, I always remind the employees in employee health that our job is to take care of those who take care of others. But if we don't take care of ourselves, we can't do that. So
100%.
one of my running theme with them always is we have the most important job in the world. During the pandemic, healthcare providers were heroes, right? It was the first time, well, probably since the plague, but it was the first time in recent memory that healthcare workers were exalted this way, right?
Yeah.
Heroes everywhere, clapping at 7 p.m. And I always remind the employees, mine and employee health, that we have an amazing job because we've got to make sure that all those folks that are taking care of everyone else are healthy and safe. How
Yeah.
do we do that for ourselves, right? Um, I have addressed it. We have had team building exercises, um, getting the teams together to get to know each other on a level, a little bit different level, uh, more feeling like a family and less like coworkers. I think if people get together and find that they have something in common, I think it makes for a better work environment. The other thing, I think, one of the other things that I've done is, and this is just me, and I don't know, this is just how I work or how it works for me. Let's put it that way. I try to get to know all of the employees on an individual basis.
Wonderful.
I get to know their personalities. In I guess my goal is to try to understand what each employee needs. For example, I may have an employee who, whenever I see them, I ask them about their grandson, for example. That elicits a bit of joy. That is a connection, right? Gets them talking about family. That's what that person needs. Whereas I may have an employee who absolutely does not want to talk about family and only wants to talk about work. So I don't ever talk to that person about family. I give them kudos for the work that they're doing, right? Talk to them about that. So I think what I've tried to do what I've learned to do, I think, in my years of management is I taking that time to really identify what each person needs or what each person responds to. Because if you approach someone who's a little bit closed off and doesn't want to talk about family, and you're coming in that way, you're not going to get a great response.
Right.
Or the flip side is if you approach someone who really cherishes that time with family, just had a new grandbaby. This is the thing that brings them joy. You bring that up. you're connecting with them. And I think that that's the way I've always approached my life in management, um, is to get to know people on an individual level and find out what they respond to.
Yeah.
I think that that builds a better relationship individually. And then again, I think as a team, those team building exercises have also become important. The third thing that I've done is honestly encourage time off. When I worked, and I still do that now. Actually, I was going to say when I worked at the previous job, but that's actually when I really started this, was to take a look at our calendar. And if I've noticed that someone has not taken time off, I will actually call them and say, hey, you've got 3 weeks of PTO and you haven't taken any. Why don't you take a long weekend? Take a Friday and a Monday to just reset. I started doing that, I'd say about 7 years ago. A, because I want people to understand that there's nothing wrong with taking time off. And B, because I want people to understand that I think it's essential to take
Yes.
time off, right?
Absolutely.
You don't get any rewards for not taking time off. There are no rewards at the end of the day. The reward for taking time off is to be able to press that reset button. So that's something that I've carried on for about the last 6 to 7 years. And everyone who reports to me knows that, if you don't take time off or put something on the calendar, you're going to get that phone call from me that says, do you think you want to take some time off? Because I think it's important.
I love that. I absolutely love that you are one of the things that I talk about is creating a pause, right? And some people are like they think that their pause is just going to be vacation, some long extended vacation, and it does not have to be a long
Mm-hmm.
extended vacation. It could be a long weekend. It could be creating a pause in your day every day. And but it's very important to restore yourself, giving yourself a moment, and a real moment, right? A
Yes.
real moment because I was reading something the other day, Dr. Jean-Baptiste. Yeah, that's weird because but I was reading something not too long ago, and it talked about even physicians going on vacation. The grand percentage of physicians that take vacation and didn't really take vacation. So like they stayed home and they did work, caught up on charts. They did,
Yeah.
caught up on all of these things, or they may have taken it with them. So they may have used an hour or 2 hours a day.
Mm-hmm.
Okay. Um, they're still doing work.
Yes.
And that's not really you're not really giving and let me tell you, my sister's a nurse, and I know for a fact she used to do this too. She used to take her computer with her, and I'm just like, no,
Guilty.
that's not trust me, it's happened to me, but it happened to me twice and I said never again because I'm like, what
Mm-hmm.
happened to my vacation? you know what happened, and so I love that you are casting a shadow, um, and being an example that you may not have been thinking about it, but really you should think about taking some time off. I know that in certain European countries, it's mandatory.
Yes.
They
And it
take
should be here.
right, right. But that's one of the things here, and that's a whole nother other long thing. People get vacation, but it's not always encouraged to take it. If you understand what I'm saying, it's
Yes.
kind of like, yeah, we really need somebody here, but we understand you do have vacation, and so sometimes you may cut your vacation short. You may say, well, instead of taking off a week, I'm going to take off 3 days because they really need me here, or things of that nature. Um, and so I always talk about creating the pause because sometimes that does happen, and you know Don't wait. Even if you have like some people have 2 weeks of vacation. There's 52 weeks in a year. All right. Are you gonna wait for those lone 2 weeks to take vacation? So I always talk about how to go about creating that pause to create some balance in your life, and the different ways that you can go about doing that. It's very simple. It doesn't have to be costly. It doesn't have to take a lot of time, but it's
Right.
very important to do that to restore your energy, to be able to recharge, to be able to keep going and not become so exhausted with
Yes,
the work that you're doing, because it's heavy work.
it
It's
is.
heavy work, and it's heavy emotionally, it's heavy physically, just constantly going from room to room, seeing patients, maybe going to the hospital, maybe, you know it's heavy work. So I applaud you for taking that on, and you've been doing that for years. I applaud that.
Well, I think that the second parts of that also is you said something really important about the physicians taking their laptops or taking their pagers or taking their phones. Um, I find it funny at this point if one of my physicians or nurse practitioners is out and they say, "But I'll be available by phone," and my response is, "Why?"
I was guilty of that too.
Guilty. I've done the same, but I think that it's a good place to be when you have evolved enough to say, "Why? You're taking this time off. I don't need you to be available by phone. You've got coverage. I don't
That's
need you
right.
to check your email. You've got coverage." I really actually appreciate, again, as we talk about the evolution, up until very recently, and again, I'm like I said, there's nothing that I'm saying that I haven't done myself. Up until very recently, if I was off, my out of office would say that I am out of the office until such and such, but in an emergency, I can be reached at blah, 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 blah. And it wasn't until, like I said, guilty. It wasn't until last year, 2023, where I changed my out of office to actually say, I am not available. I will be returning on such and such date. I recently I took 2 short trips this year and did not take either my work phone or my laptop with me. Was it stressful? Yes. Did I feel like I was going to miss something? Yes. But then when I came back to work, I realized all the buildings are still standing.
Yes,
Everything was still taken care of.
true. But can we talk
Not and
about the other part though, right? That makes it a little stressful. Sometimes, if you allow it to, you don't know what you're coming back to. The
true.
emails, the calls, the you're like, oh my goodness, it's almost. We used to joke and say, "Is this like
It's
punishment for
almost
going
not worth
away?"
taking the vacation. Yes, we've all said that, right? You come back, you take a week off, and you have 1,297 emails,
There you go.
right?
And it was at
And then you
zero
spend the
or at
first
5.
4 days, right? You spend the first 4 days just like unburying yourself from the email, and you're thinking to yourself, why did I take time off? Because you have to.
Because you have to.
I think that's the answer. It's because you have to.
Yeah, I agree. Absolutely. So now, and I love that. I hear that with how you've changed how you approach and how you show people, literally show
Yes,
them how to approach. Because I agree with you. I kind of always say, if I am telling you that I'm not going to call you because you are on vacation, I'm actually looking to you to mirror that with me. you know, because I am
agreed.
on vacation. Like, if the place is not
Agreed.
on fire, there really is no reason.
Agreed. And here, this is my line, honestly. If there is a true emergency, like the building is falling, you really should be calling 911,
911.
right? You don't need to call me.
Call the fire department.
Yes,
Call.
exactly.
You need to call 911. You're absolutely correct. So now, how do you prioritize and find time for professional development in your career? Like what activities do you do?
So, having recently finished my MBA a few months ago, um, how did I find time? I'm not entirely sure. I think the past 2 years was a blur. Um, there were a lot of after hours studying. So, how did I find the time? I think more to do. The fact that I had more to do, or the fact that I had to study in the evenings, forced me to be more organized during the daytime with work. Uh, for example, really having a set plan. Um, if I had a class and there was a paper due on a specific day or a test that I had to take on a specific day, mapping out that time during my work day so that I maximized what I needed to accomplish during the workday, and then full stop, right? I would have to put a full stop to it and then be able to then focus on my studies. Um, I am a mom, and that did add, a level of complexity, right? You've got children in the home, and they still have their needs. If you've got a family that's involved in things, I happen to have a son that's involved in sports, so I really think that particular period of time, I was super organized. Um, and made sure that everything was written out. I had, I went from a calendar on 5x7 paper to a calendar on 8.5x11 paper, right? So that everything was in really big print, but was more clear. I mean, Judy, I even use different colors, right? I use
Yes.
different colors for different activities so that I knew if it was this particular color, it was related to my son in sports. But honestly, I think at the end of the day, it was a completely different level of organization, and giving myself deadlines for things, right? That there was nothing that was open ended, right? There had to be a deadline because I had something else to move on to, and I think that is what really helped me get to this point of actually being able to maintain my full-time job, which coincidentally I started at the same time as I started this additional degree. So
Yes.
being able to really be organized, give myself deadlines, or well, deadline sounds a bit harsh, but actually it was deadlines, of when things had to get done so that I can turn the switch off from work, turn the switch on from school, turn the switch on for kid activities, um, multitasking. I
Yeah.
do remember using my time wisely. That's what we're going to call it. I'm not going to call it multitasking. I do remember many a night at a practice for something. I would use the time wisely. If you're going to be sitting outside of a gym while your child is doing something for an hour to an hour and a half, that's an hour or an hour and a half where I could either get some studying done. Right, I would have my iPad and I would work on a project or a class, and or get life things done, right? If you've got that time, I'm not going to sit there. I'm going to choose this day to go grocery shopping. So I think it all ties into actually mapping out your time and trying your best to use it wisely so that there wasn't wasted time. I think that's the thing that got me through.
I think that is so good because you spoke about the different parts of your life that, from what I can see, you had to balance, right? The children are there, you can't just let that fall, right?
Right.
um you're doing work, you're bringing in money, making sure things are moving, especially when kids have all these extracurricular activities,
Mm-hmm.
um and you're making sure that you're getting things done. I love how you spoke about just scheduling just scheduling things. Like sometimes you even have to schedule the rest. You have to put it on there. You have to schedule the rest. You have to schedule the self-care. And one of the
Yes.
things that you were much better than I was at, um, was we both had like packages for massages. You were using
Yes.
yours.
Yes.
I
Isn't it
was
funny that I
using
talked
mine
about
like
all
they were
those things?
tchotchkes.
Yes. But isn't it funny that I talked about all those things and forgot to talk about the things that I had to schedule for myself, right?
Yes.
Getting your hair done
Yes.
or getting your nails done, which is something that, I never let go of, right? That was always something that
Right.
I maintained because that made me feel good. And you're right. I did do the massages. I didn't use as many packages as I should have.
You use much more than
However, I did try to make sure that that was something that was something that I did for myself. Now, that said, you do know that during that hour you're laying there and the 50 things that you need to do were still going through my mind, yet I used my package, right? Um,
yeah.
and it's interesting. This kind of leads to something that I thought of this weekend, or actually last week, because it was about a week ago, and I was trying to figure out why is it that before I go to bed I'm like thinking, because you're planning, right? And what happens is that you're planning your day, you're planning that time, because again, you're trying to make sure that you have time for all of that stuff. And I said to myself, this is what keeps you up, right? It's great that you're trying to be organized and you're trying to make time for things and you're thinking to yourself, okay, tomorrow is this day and I've got to get up and do this, and this. And then I thought, but that keeps you up because you're thinking tomorrow is this day and you've got to get up and do this, and this. So I did something very strange last week and I haven't had a chance to talk to you about it, but it was a really strange thing. I wrote an email to myself in bed. I wrote an email of the things that I needed to do. I said to myself, you know what? This is what the things you said you want to do because you don't want to forget them. But these are the things you said you need to do. So I said, you know what? Write an email to yourself. Tomorrow morning, you'll look at the email. So what I've been calling it, and I've been doing this for a week now, I'm really proud, is my nightly brain dump.
Yes. So I was about to say to you, I was literally about to say to you, so very good. I'd go one step further, okay, and take it back a bit
Mm-hmm.
because I don't really like the blue light and what it does to us.
Yeah.
I got a little notepad, that
Okay.
moleskin notepad is about this big,
Yes.
so that and put it right on the nightstand so that I could brain dump if I feel like something is keeping me up, and that way I'm not picking up my phone and have all that blue light coming at me.
Ah, interesting. Okay.
So I'm taking technology down a bit. It's allowing
Mm-hmm.
me to do that, and still because I agree with you 100%. You're like, okay, I gotta do this and that and that and that and that, but it's allowing me to brain dump without doing all of that. And at the very least, even if I'm still having problems sleeping, it allows my brain to rest better. I always tell people
Yes.
that some people, rest and sleep is not necessarily the same thing, because some people have very
Mm-hmm.
restless sleep, right? And some people don't sleep as much, but they rest a little better and they know how to clear their mind, to get the rest that they need. So definitely see how that works. I'm very proud of you for doing the dump a whole
I
week.
can't believe that we were doing the same thing. And to be honest, I think, I think the only reason why I didn't write it down is because I took a shortcut, right? I'm not typing. I'm speaking, right?
Very nice.
I am speaking into the phone and it's typing and sending me an email.
Got
So
it.
I'm using the audio function because I feel like I can get more out, right? And it doesn't matter if it's grammatically correct. It's just to me, all
Right.
right?
But you can get it
So
out faster.
exactly.
Yeah.
I press that voice button and I am just spewing out the things that are in my head that I'm thinking of. it forms an email that probably only one person can understand the next day, and that would be me, but that's okay.
That's fine.
And I think that that's the shortcut. Yeah, that's the shortcut that I took instead of sitting there and physically writing things down, because I almost feel like it would probably take too much concentration. So that's why I've been doing voice. I mean, I guess it would be the same if you did a voice note to yourself, right? For the next day.
Yeah.
I just do the email because that's the one thing you're always going to be checking. So I figured the following morning, as soon as I open things up, I've got my not necessarily intelligent email, but at least I'll know what I was talking about.
Absolutely. Absolutely. So now one of the things I want to know is what type of things do you do for your wellness? I know you get massages, so that's good. What type of things do you do for your wellness?
The biggest thing that I have reconnected with is reading. Now that I'm actually done with that second degree, reading has become it's silly to say this at this point in life, but it's almost like opened up a whole new world for me because I am reading things that I enjoy, right? I'm not reading to take an exam. I'm not reading because the professor said so. I am I have reintroduced myself to the world of books. Growing up as a kid, reading was it was my solace. That was the thing that I did. My very frequent trips to the Brooklyn Public Library, I would come home with books and be done with books in a day. Be done with bigger books in a weekend. You know, it was almost as if my parents couldn't keep up with taking me to the library to read.
Yeah.
And this is something that I've always enjoyed, right? I've always had, specific authors that I've loved. Just a plug to James Patterson. Right now, I'm in my James Patterson phase of life. And I'm just running through his books and I'm loving that time. You still, the basics still happen, right? You're right. I still get my massages. I get my hair done. I go get my nails done. But the time for me has been my reading. I recently, as you're aware, recently remodeled my home, redecorated. And I now have one of the things that I've always wanted was to be able to have an area where I can sit and read. So I have a little reading nook in my bedroom. I've got a little love seat. I've got a beautiful lamp. I have a little side table where I can put my cup of tea. And to be able to take that time, for me, that is the most wonderful escape. I've also started listening to audiobooks in the car. On to and from work, you're driving for miles. Some of my trips are an hour, and I realized one day that I just kept hearing the same songs over and over again. And it didn't matter if you changed the station, you're hearing the same thing. You put on the news, you don't want to hear anymore. And I decided that time I'm also reclaiming. And now what I do is as soon as I sit in the car, I listen to audiobooks. Again, I'm having a blast, right?
Yeah.
The trip to and from, even to the supermarket, is less stressful because now I'm again immersing myself in books. For me, that has been enlightening to be able to take that time back.
That's
Um,
wonderful.
and do something that I really, really, really enjoy. So reading has been it for me. It's been amazing.
And I love how you said just now, because that's one of the things that I teach people is to find what brings you joy, but also pull back on the stuff that may be causing you angst. So when you said the thing about, I don't want to listen to news every day. It's not always pleasant, right?
No,
Some people say, but you have to know the news. I have to know what I have to know, right?
Right.
Like if I'm going out, I have to know the weather, right? Um, and I'll quickly go on my weather app, find out the weather, and that's that. So one of the things when talking to other healthcare professionals about prioritizing your well-being, that's one of the things. Remove the stuff that is not helping your well-being, or at least pull back on it as much as is possible for you to be able to get through your day.
Yes.
If you need to, if you know you need, obviously, if you have children, you probably need your phone because you can get a call at any time when the kids are at school, right? So there's only so much you can do of that. But at the same time, I also use my phone to put an alarm on there. So at 11:45 a.m. every day, it reminds me to take a moment. I don't have to feel stressed out at all, but that's how I keep myself going, right?
Yes.
I'll take a moment, take a mindful moment, get up from the seat, walk, maybe go outside, get some sun now that it's really like getting warm and sunny, and do that. And so I love how you are utilizing your time with things that you want to do, and not because you could easily sit in that car and do the same thing you were saying about being in the bed and or being in the massage table. You could be thinking about, I gotta get this done today, I gotta get this done today, I gotta get this done today, right? And you have now chosen that even on the short ride to the supermarket, I could spend 10 minutes listening to the audiobook,
Absolutely.
listening to a song that I love, you know,
Hmm.
or be like me, just turn the music up and roll my window down and get fresh air. Um, and so I really like that. Does your job have wellness programs where they're prioritizing or teaching the employees to prioritize their well-being?
100%.
Yeah.
We actually have a really robust wellness program virtually on our phones. We do have an app that we all have access to, which gives you daily cards, they're called, right? And you choose the cards based on your interests. That's what would come up. You have daily cards, and then they have something else on this particular app called your daily journeys, right? So let's say you are, of course, I'm a physician. I'm going to pick something medical. Let's say you have high blood pressure. You can actually join the daily journey for those who have high blood pressure. And it's just small snippets that you are reading. It may give you, maybe a minute of reading about a particular exercise to do, or a particular food to avoid, or what are the connections with hypertension and heart disease. So we all have access to it. We log on, and again, depending on the interest that you set, because it actually starts with a health assessment, which takes about a good 30 to 45 minutes to fill
Yeah.
out. And it's a really comprehensive assessment. And from there, it sets your interests, and you can daily go on to this app on your phone and actually go through either the daily cards or the daily journeys. Secondly, the wellness program obviously is not just virtual. We have wellness coaches who throughout the year have programs that they put together. There was one actually that I participated in, which was great. We had a 5K walk. But prior to the 5K walk, because the first thing I thought when I was signing up for that is, oh, I can't walk 5K. Are you kidding me? I'd be passed out. And I'm not the only person who thought that. So what they did was weeks before, they actually had coaching sessions. And they had coaching sessions up until the walk. So what does it mean? So during the coaching sessions, which I thought was amazing because I did do it, during the first coaching session, they gave us an exercise plan to build yourself up to be able to do that walk.
Yeah.
So literally, it was a calendar, and daily there were small things to do. And then again, during the months and weeks leading up to the actual walk, we had Zoom meetings that you can sign up for with the wellness coaches. And it talked about just getting yourself healthy getting yourself ready for that walk. That's just one example, but the coaches have these virtual sessions all year long. It may be, for example, it may be in response to something, right? If there's something catastrophic that happened, they'll have, an ad hoc one that they'll schedule and you can come on. But throughout the year, they'll do it on managing stress, taking care of yourself, exercising, dieting. So it's something that I have taken advantage of. Usually the meetings are via Zoom. They're usually during lunchtime, sometime between 12 and 1, which makes it, much easier to be able to participate. And they're interactive. The expectation is that you're on and that you're fully engaged. They will call on you. They will ask questions, because I think that if you're going to sign on for something like that, it shouldn't be where it's on one of your screens and you're really not paying attention. If you're not paying attention, what are you getting from it, right?
Right.
So I remember the first time I got on, they actually did call my name, and I was like, oh my God, they're paying attention. But then I thought, wait, but I need to be paying attention, right? I signed up for this for a reason, so I need to be paying attention. So
You needed to be there now, right?
I needed to be there now, yes.
Yeah,
And I just, so again, as I said, I have participated in these wellness sessions that happen throughout the year. The other thing that happens is, and the Robert Wood Johnson Barnabas Health System is comprised of 12 different hospitals. And no matter which hospital you're in, they have screens up, and they'll have like rolling messages for the employees, and you can see that, right? If there's a particular theme for the month, they'll have messages, and they'll let you know like when coaching sessions are, or what you can be doing, or what you should be looking out
Very
for.
nice.
So I feel like it's a message that's always there. It's also on our computers, right? You open up your computers, you get on our intranet site. And there's always wellness information, right? There's always things that we should be doing, things we should be looking out for. Is it safety month? Is it heart disease month? So I feel like that message is always, it's coming to us in different ways, which is great.
No, that's wonderful, because definitely just paying attention to their wellness and their overall, or teaching
Absolutely.
them that, I really believe in them taking some onus and being their own healthcare CEO from all the different parts, and including their professional life and their personal life and all of that goes together, because they both interact and affect one another. So I think
Yes.
that that's really wonderful that they're doing all of that. That's great that they have those reminders as well. So we are coming to an end, but I'm going to ask you a couple of questions. They're going to make you think a little bit. So, are you ready?
I'm ready.
Okay. Looking back, what do you wish that you knew at the start of your career?
Whew. I wish I knew that I could put myself first.
Did you
I
think you
wish I
couldn't?
knew. Did I do that in the past?
No, did you think you couldn't?
Absolutely. I did not think I should. As a physician, I know it says physician heal thyself, but none of us heard that part. I think that as a physician, you're almost taught that you are there at the service of others.
Yeah.
And very rarely are we to take care of ourselves. I mean, running joke for any medical student and or attending, do you eat standing up, right? You're always on the move, you're always doing something. You never take the time to stop and take care of yourself because you're taking care of others. I wish I knew then that it's okay for me to pause and actually take care of myself. It's okay for me to sit and actually have lunch and not do anything else. It's okay for me to not be sitting in front of my computer with my lunch. I can actually sit and disconnect. I think that to me would have been the biggest lesson. Is I really wish I knew 20 something years ago that I actually could have put myself first and that would have been okay.
Yeah, that's excellent. That's just the even I can disconnect. And that's
Yes,
on different levels, right? Not just for work. I can disconnect. I can take time off really to do absolutely nothing
yes.
and shouldn't feel guilty about that.
Well, I still struggle with that one. Full
I know
disclosure,
you do.
still struggle with that one.
I know you do. I'm kind of
I'm
telling
not
you that
there yet.
you can disconnect
I'm listening.
and do absolutely nothing, and that's okay.
Okay.
I need to say it a little bit, maybe more crass than that, but you know what I'm saying.
Yes, and I think we probably are going to have to say that again and again because this is life is an evolution, and I think as far as I feel like I've come, I just don't even think I'm there yet where I can do nothing.
Yeah,
Yeah.
yeah, I understand. And it's kind of built into us as physicians, as women, as mothers. It's like we really do think. I think when I had to plan my wedding all those many moons ago, I was doing that, doing a master's program, started a new job, and I kid you not, once we came back from our honeymoons after over a year of doing that, my body literally crashed because it didn't know, and I got sick, like because it was so used to running just constantly, right? But I like I'm telling you, had to learn that it's okay to just sit down and breathe and do nothing. Um, so the last question that I want to ask you is, what advice would you give to new professionals entering the healthcare field today?
Find a mentor. Find someone who has been through this, who can give you real life advice about what it takes to get through medicine, have your career, and have your balance. Um, there, a very quick story when we were, actually, it's not a story for you because you and I both know the same story, but we were rotating through our third year. Was it our third year clerkship? It may have been second. And we were rotating through a particular hospital, and you and I met a physician, um,
Yes, yes, it was
female.
second. It was second.
Yes, it was the second year. So we met a physician, female, and I remember both of us, with like deer in the headlights look because we were, incredibly nervous about what we were going to find. It was the first time that we were actually going to be rotating through the hospital and actually, touching real people and seeing real patients. And I remember seeing her, and she was a chief resident at the time, and she just looked put together. She looked fabulous, right?
Yes,
She had her hair done, her face was done. She had beautiful long white coat because we had short coats. She
beautiful
had
nails.
her nails done, and we both looked at her in awe, like, how does she have? I mean, to this day, it's almost like she came over and she had like a halo around her. It's like, how does she do all of that? Um, and she remained a mentor, and became a very dear friend to both of us.
Yeah.
But what both of us came away with that day that we met her, and that time that we spent with her subsequently, was she stopped and took care of herself, right? And has done that throughout her career.
Yes.
And I think that you and I, having had her as a mentor, and also having each other, have also used that example over the years, right? Of how to take that time for you. So I think if I am talking to anyone new and I have offered my services as a mentor for young professionals, and not just in medicine, um, just being able to connect with someone and speak to someone who can give you this real life guidance on how to get through. I think, as a physician, I'm biased. I think we need that more than ever as women in medicine.
Yeah,
But I think to me, male or female, I think it's necessary. But I think for women more
absolutely.
so, right? Because there's a little bit more of a juggling act that happens in
Yeah,
medicine because of the commitment. So my advice is find a mentor, find someone you can connect with, find someone you're comfortable with, find that person that can help guide you through the process.
that is excellent. Excellent, excellent, excellent advice. Dr. Jean-Baptiste, thank you so much for coming, giving your time, talking to us, dropping these gems. I really appreciate it. For those who stayed this long, thank you so much. And if you did stay this long, like, comment, share, and we will definitely see you next time. Bye.
Thank you.